Our goal is your satisfaction. Let us show you the way.
When should I be concerned about a barking cough? Severe croup can cause breathing difficulties in general, but if your child's skin caves in around their neck or ribs when they try to inhale, you should seek urgent medical treatment. Serious infections can also cause stridor, which is noisy breathing, often high-pitched, caused by the narrowing of the airway. What helps a barking cough in adults? Home remedies. Use a humidifier. This device can help moisten the air, which could make breathing easier. Drink lots of fluids. Staying hydrated is important when you have croup. Rest. Getting enough sleep can help your body fight off the virus. Stay in an upright position. Use over-the-counter pain relievers. What does a COVID cough sound like? What does a COVID cough sound like? Believe it or not, COVID coughs do have qualities that set them apart from an average cough. Dry cough. It sounds like someone's hacking up a lung. It carries a consistent, rough tone because it doesn't contain mucus. Can adults have laryngitis croup? Croup is a viral infection that causes a barking cough in children. Croup in adults is rare, but possible. The medical name for it is laryngotracheitis. Other symptoms of croup include fever, hoarseness or laryngitis, and noisy or labored breathing. Do you need antibiotics for croup? Antibiotics. Since the causative organism in croup is always viral, antibiotics are generally not warranted. Children may present with bacterial superinfections such as pharyngitis or pneumonia, which do require antibiotic treatment. Since cases of superinfection are rare, antibiotic prophylaxis is not indicated.
Take our lead. Let's help you make your mark.